Hello, my name is Dr. Anil Medagam. I am a student of University of South Wales, Cardiff, UK. By profession, I am a doctor in NHS UK. I am producing this video as part of my course in Diploma in Diabetes. My target audience today are all diabetic patients, type 1 and type 2, and also their carers. My intention of making this video is to educate about the complications of uncontrolled diabetics. I would like to talk about diabetes and its effects on blood vessels. Diabetes affects both large blood vessels and small blood vessels. As part of my course, in this video I would like to concentrate on effects of diabetes in large blood vessels. Some of the facts I am going to tell you are not to scare you, but to create awareness, to get stimulus, to get proper advice from your healthcare provider, to maintain blood glucose levels and avoid preventable complications and decrease the risk of developing complications. There are several complications. I would like to explain one by one briefly in this video. First thing is effect on blood vessels in the heart. Heart attack, as you all know, decreased blood supply to the heart muscle, which can cause pain initially, which is commonly known as heart attack, and the failure to pump the blood if the damage is significant and permanent. And compared with non-diabetics, in diabetes patients, the risk is 4 times more of this complication. And the second thing is effect of blood vessels in the brain. The complication which is more common in the brain due to blood vessels is stroke. Stroke is, as you know, injury to the brain due to blood clot or bleeding. And similarly, compared to non-diabetic patients, stroke is twice as common in diabetes patients. Third thing I would like to mention is effect of blood vessels in the foot in diabetes. In diabetics, the diabetic foot is very common, and the complications are more common compared to non-diabetics. The complication that is affected mainly are non-healing ulcers. The ulcers that form in the foot take longer time to heal, and also it may lead to further complications like charcot arthropathy and osteomyelitis in diabetes. This may lead to unwarranted conditions called amputations, which can be small amputation, below knee amputation, or above knee amputation, which are due to diabetes and its effects on blood vessels, which can be prevented. Last but important issue is erectile dysfunction, which is much more common in diabetic patients than non-diabetes. The cause of all these is high blood glucose level that causes damage to the blood vessels. How this high blood glucose level causes damage to blood vessels is slightly complicated. I would not explain in detail in this video because this is beyond the scope of my audience. But the lowering of blood glucose levels cause decreased risk of all these complications. This is evidenced by several scientific studies like UKPDS Accord, Advance, VADT Proactive. There is another thing that I would like to mention. Earlier control of blood glucose is very important because there is a thing called diabetic memory. Blood vessels has memory. If the blood glucose levels are very high for long term, it causes more damage and it causes more complications. So earlier control of diabetes and earlier control of blood glucose levels causes less damage to the blood vessels and less complications. So My advice is for all the diabetic patients, get glucose levels checked and maintain properly with expert advice and avoid all these complications. I hope this helps my audience to get some awareness of why blood glucose level need to be controlled to avoid complication and lead a healthier and longer life.